गुड इवनिंग टू ऑल ऑफ यू। आप सभी को नर्सिंग विद विनोद सर यूट्यूब चैनल में स्वागत है। आज हम देखेंगे उड़ीसा ट्रिपल एससी नर्सिंग ऑफिसर का मोस्ट प्रोबेबल मल्टीपल चॉइस क्वेश्चन विद एक्सप्लेनेशन जो एनक्लेक्स पैटर्न में है, डे 9 है। सो बिफोर स्टार्टिंग ऑफ टुडे सेशन यू मस्ट हैव टू टेक केयर योरसेल्फ अगेंस्ट पैंडेमिक कोविड-19। मेहनत इतनी खामोशी से करो कि सफलता शोर मचा दे। तो इसके साथ आज का सेशन शुरुआत करते हैं। फर्स्ट क्वेश्चन, द स्टेटमेंट ऑफ बिलीफ एंड आइडिया व्हिच आर कंसीडर्ड टू बी ट्रू आर नोन एज। ऑप्शन ए हाइपोथेसिस, ऑप्शन बी assumption, ऑप्शन सी conceptual definition, ऑप्शन डी operational definition. So put your right response in the chat box. Okay, those who are putting B option, their answer is correct one. Okay, assumption. You must have to remember. Answer is assumption. Now we'll come back to next question. A literature review is option A, everything that is known about subject. B option, an analytical summary of research finding. C option, all approved data on a research topic. D option, a compilation of all positive results of the research. So what is the right answer of this question? Here the right response will be the option A. Answer is option A. You must have to remember this one. Okay. Now we'll come back to next question. The literature review should occur. Option A, near the end of research process. B option, shortly before the analysis of the problem. C option, early in the research process. D option, none of the above. So put your right response in the chat box. Here the right answer would be the C option, early in the research process. You must have to remember this. Have you got it? Now we'll come back to next question. Which of the following is not a method of data collection? A option, interview. B option, experiment. C option, questionnaire. D option, observation. So here that interview, okay, questionnaire, observation. These are comes under, these are the methods of the data collection, but experiment is not a method of data collection. So here that answer would be the experiment is not a method of data collection. Have you got it? Answer is B option. Okay, now we'll come back to next question. Which of the following is the formula for rain? Option A, H plus L. Option B, H into H, L into H. C option, L minus H. D option, H minus L. So what would be the right answer of this question? So here that answer would be the D option, H minus L. You must have to remember this. Have you got it? Now we'll come back to next question. The measure of central tendency that represents the score most occurring in a distribution of score is called A option mean, B option mode, C option variable, D option median. So here that answer would be the B option, that is the mode. You must have to remember this. Okay, have you got it? Answer is the B option. Now we'll come back to next question. Which of the following is an example of dichotomous variable? Option A, age. Option B, gender. Option C, educational status. Option D, occupational. So what would be the right answer of this question? Answer would be the B option, that is the gender. You must have to remember this one. Which of the following scale of measurement has an absolute zero? A option में nominal, B option में ordinal, C ऑप्शन में इंटरवल, डी ऑप्शन में रेशियो. Nominal, ordinal, interval, another the ratio. So what would be the right answer of this question? Here that answer would be the D also, that is the ratio. You must have to remember this. Okay, now we'll come back to next question. A careful appraisal of the strength and weaknesses of the study. A option, research proposal. B option, action research. C option, research critique. D option, evidence based practice. So what would be the right answer of this question? Here the answer will be the C option. Research critic. You must have to remember this one. C option. Okay, now we'll come back to next question. What is the normal color of amniotic fluid when the bag of water rupture? A option में H like water, B option bluish, C option brownish, D option yellowish. So what would be the right answer of this question? Here the question is asking about normal color of amniotic fluid. Normal color of amniotic fluid. So here answer will be the H like water. You all have to remember this. Okay. Now we'll come back to next question. Which of the following measures would the nurse include in the teaching plan about the method to prevent breast engorgement in the postpartum period? Option A, breastfeeding the neonate at frequent interval. B option, decreasing fluid intake for the first 24 to 48 hours. C option, feeding the neonate a maximum of 5 minutes per site on the first day. D option, wearing a supportive brassiere with a nipple seal. So what would be the right answer of this question? Put your right response in the chat above. Those who are putting A option, their answer is correct one. Breastfeeding the neonate at frequent interval. You must have to remember this. Now we'll come back to next question. Postpartum hemorrhage is loss of blood, which is more than 800 ml, 100 ml, C option 500 ml, D option 900 ml. What is the meaning of postpartum hemorrhage? Always you have to remember the loss of blood, okay, which is more than 500 ml, then that is known as PPH, postpartum hemorrhage. You must have to remember this one. Now we'll come back to next question. According to WHO, according to World Health Organization, when should the mother start breastfeeding the neonate? Within 30 minutes after birth, within 18 hours after birth, after infant's condition stabilizes. D option, within a day after birth. So what would be the right answer of this question? Here the answer would be the A option. That is within 30 minutes after birth. You must have to remember this. Now we'll come back to next question. The indication of forceps delivery is A option, delay in the first stage due to hypotonic uterine contraction. B option, delay in first stage due to hypertonic uterine contraction. C option, delay in second stage due to hypotonic uterine contraction. D option, delay in second stage due to hypertonic uterine contraction. So what would be the right answer of this question? Here that answer is the C option. Delaying second stage due to hypotonic uterine contraction. You must have to remember this. Answer is C option. Now we'll come back to next question. What is the positive sign of pregnancy? A option, frequency of micturition. B option, vomiting. C option, Braxton Hicks contraction. D option में fetal outlined by sonography. Positive sign of pregnancy. Okay, what might be the right answer of this question? That is D option. That is fetal outlined by sonography. You must have to remember this one. Have you got it? D option is the right answer. Now we'll come back to next question. Which gland is responsible for initiating the menstrual cycle? A option, hypothalamus. B option, anterior pituitary gland. C option, posterior pituitary gland. D option, ovary. Okay, which of the following organs or gland is responsible for the initiating the menstrual cycle? So your answer will be the hypothalamus. Answer is A option. Now we'll come back to next question. What should the nurse answer if the mother asks, what does it mean if her maternal serum alpha protein is 35 nanogram per ml? A option, it is abnormal, it is not clear. 35 nanogram per ml indicates chromosomal aberration. 35 nanogram per ml indicates neural tube defect. So what would be the right answer of this question? Okay, here that answer would be the B option. It is not clear. Okay, you must have to remember this. B option. During a routine prenatal visit, a pregnant patient reports heartburn. To minimize her discomfort, the nurse should include which suggestion in the plan of care? A option, drink more citrus juice. Okay, or you can say lemon juice. Okay, citric acid is much more present in the lemon. Okay, lemon juice. B option, eat small frequent meal. C option, limit fluid intake sharply. D option, take sodium bicarbonate. So what would be the right answer of this question? Okay, during routine prenatal visit, okay, that pregnant woman is reporting heartburn. So what should be your duty? To suggest her, you always suggest to her, eat small and frequent meal. You must have to remember this one. B option. Now we'll come back to next question. When is the best time to achieve pregnancy? Midway between 7th and 8th day of ovulation. B option, immediately after starting of menses. 14 days after the beginning of the next period. 14 days before the next period is expected. So what would be the right answer of this question? Put your right response in the chat box. So your answer is the D option. Okay, you must have to remember this. 14 days before the next period is expected. You must have to remember this one. Now we'll come back to next question. After determining that pregnant patient is RH negative, gynecologist order an indirect womb test. What is the purpose of performing this test in pregnant patient? To determine fetal blood RH factor, to determine the maternal blood RH factor, to detect maternal antibodies against the fetal RH negative factor, to detect maternal antibodies against the fetal RH positive factor. So what would be the right answer of this question? Here that answer would be the D option. To detect maternal antibodies against fetal RH positive factor. Always you have to remember this one. Okay, now we'll come back to next question. To determine fetal position using Leopold's maneuvers, the first maneuver is to determine the degree of molding, determine the position of the fetus, determine what parts of the fetus is in the fundus. D option, locate the back, arms and leg. Okay, first maneuvers. Okay, what it will indicate or what it will determine. So your answer would be the C option. Determine what part of the fetus is in the fundus. Answer is the C option. Now we'll come back to next question. What is the WHO criterion for minimum sperm count in normal semen? 60 million, 15 million, 20 million, 30 million. So what would be the right answer of this question? Put your right response. Answer is the, okay, what would be the right answer? B also. Okay, 15 million. Okay, 15 million. You must have to remember this one. Now we'll come back to next question. The uterus has already risen out of the pelvis and extending further into the abdominal area at about 8th week of pregnancy, 10th week of pregnancy, 12th week of pregnancy. D option में 18th week of pregnancy. So what would be the right answer of this question? Here that right response is 12th week of pregnancy. You must have to remember this one. You must have to remember this. Have you got it? Now we'll come back to next question. 7 weeks after the conception, the growing structure inside a uterus is called zygote, embryo, fetus, neonate. What will say here? Okay, 7 weeks after the conception. Okay, within the conception, then that is known as embryo. After the 7 weeks after the conception, means it is fetus. You must have to remember this one. Okay, you all have to remember this one. Now we'll come back to next question. Which of the following doses of Rh immunoglobulin ROGAM is appropriate for a pregnant patient at 28 weeks of gestation? 0.6 microgram, in a sensitized patient, 50 microgram in an unsensitized patient, 30 microgram in an sensitized patient, 300 microgram in an unsensitized patient. So what could be your right response here? Answer would be the D option. That is 300 microgram in an unsensitized patient. Now we'll come back to next question. True labor is characterized by effacement and dilation of the cervix, painful uterine contraction, suprapubic dysfunction at the regular interval. D option may all of the above. So what would be the right answer? Okay, that is effacement and dilatation of the cervix. You must have to remember this one. Now we'll come back to next question. Which of the following condition is common in pregnant patient in the first trimester of pregnancy? Breast abscess, metabolic acidosis, physiologic anemia. D option में respiratory alkalosis. So here the answer will be the physiologic anemia. You must have to remember this one. C option. Now we'll come back to next question. Major complication in third stage of labor is perineal injury, postpartum hemorrhage. C option shock, involution. D option uterine rupture. So what would be the right answer of this question? Answer is the D option, postpartum hemorrhage. Now we'll come back to next question. Oligohydramnios is a condition when amniotic fluid is less than 75 ml at term, 100 ml at term, 150 ml at term, 200 ml at term. So what would be the right answer of this question? Answer would be the okay D option, 200 ml at term, less than. The answer is D option. Now we'll come back to next question. Postpartum hemorrhage is caused by atonic uterus, blood coagulopathy. C option traumatic, D option all of the above. So answer is the all of the above. You must have to remember this. Now we'll come back to next question. The danger of convulsion in a woman with pre-eclamptic toxemia ends soon after delivery, 12 hours after delivery, 24 hours after delivery, 48 hours after delivery. Okay, so what would be the right answer of this question? What would be the right answer? Here the answer would be the E option, soon after delivery. Answer is E option. The most common complication in low birth weight infant is, or we can say baby. Okay, instead of saying that infant, you must have to mention that is baby. Low birth weight baby. Respiratory distress, mucous damage, C option में brain damage, D option में hemorrhage. So your answer will be the respiratory distress. A option is the right answer. The shape of brim of gynecoid pelvis is flat, oval, C round, D option triangular. Okay, it is asking about the gynecoid pelvis. Okay, shape of gynecoid pelvis. Okay, where that brim is there. Okay, so answer is the round. You must have to remember this one. Now we'll come back to next question. Physiological anemia during pregnancy is a result of increased blood volume, decreased dietary intake, decreased erythropoiesis after first trimester. D option increased detoxification demand on mother's liver. So what would be the right answer of this question? Here your answer will be the E option, increased blood volume. You all have to remember this one, E option. Now we'll come back to next question. The most important predisposing causes of puerperal infection are hemorrhage and trauma during labor, malnutrition and anemia during labor, during pregnancy, toxemia and retention of placenta, streptococcus present in the birth canal, and trauma during labor. So what would be the right answer of this question? Here the answer would be the okay, B option, malnutrition and anemia during pregnancy. You must have to remember this. Gestational sac can be seen in ultrasounded 6th week of gestation, 8th week of gestation, 10th week of gestation, 5 weeks of gestation. So what would be the right answer of this question? Here the answer will be the E option, 6 weeks of gestation. You must have to remember this one. Major side effect of oxytocin is diuresis, hypertension, uterine hyperstimulation, uterine atony. So what would be the right answer? Right answer would be the hypertension. You must have to remember this one. Tocolytic agents are used to enhance the preterm level, suppress the preterm level, enhance the normal level, suppress the normal level. Tocolytic agent. Okay, so answer would be the B option. Suppress the preterm level. You always remember this one. Now we'll come back to next question. pH of vagina during pregnancy is acidic, basic, neutral, sometimes acidic and sometimes basic. Okay, that answer would be the acidic in nature. E option. Softening of the cervix during pregnancy is termed Jacquemeyer sign, Osiander sign, Goodell sign, Hagar sign. So what would be the right answer of this question? Answer would be the Goodell sign. You must have to remember this. A female who has given birth one viable child. Viable means living child. What is the meaning of viable? The meaning of viable is living child. Is termed as primipara, multipara, nulligravida, primigravida. So answer would be the primipara. You all have to remember this one. Pantograph is first planned by Robert Jacobson, Friedman, Chadwick. So what would be the right answer of this question? Answer is the C option, Friedman. Commonest causes of breech penetration: hydrocephalus, prematurity, multiparity, hydroamnios. Commonest cause of breech penetration. Answer is the prematurity. You all have to remember this one. Definitive treatment of placenta previa include bed rest, supplementary hemanetics, use of tocolytics, caesarean section. Good answer would be the, what would be the right answer of this question? Answer is the D also. That is the caesarean section. Elderly primigravida is defined as women having first pregnancy above age of 25. Women having pregnancy above the age of 30. Women having their first pregnancy below the age of 18. Women having the first pregnancy above the age of 35. So what would be the right answer here? Answer would be the D option. You all have to remember this one. Elderly primigravida. There are several differences between a leader and a manager. The manager does not have formal authority, subordinate follower, responsibility. That answer would be the C option, followers. Manager does not have followers. The nurse manager has several roles and function to play. Which of the following function given below is least important? Decision making, monitoring and evaluation of strategy, effective leading, manipulating people. So what would be the right answer of this question? Answer would be the manipulating the people. This one is the least important. सबसे कम. The nurse manager requires several skills to be effective in her work. Which of the following skill is the most important skill to have an effective nurse manager at all levels of management? Technical skill, conceptual skill, human skill, supervisory skill. So here that answer will be the C option. That is the human skill. Now we'll come back to next question. Leadership is important for the success of any organization. The following is an important element in leadership except there must be a leader and followers in the organization. The leader is a usual autocratic. There is an unequal distribution of power between the leader and the follower. Leaders can influence the behavior of their followers. So what would be the right answer of this question? Here that answer would be the B also. That's all for the day. See you tomorrow. Hope you all enjoyed a lot. Thank you very much to all. आपका ख्याल रखिए, परिवार का ख्याल रखिए. जय हिंद, जय भारत. Thank you all of you. Good night to all. See you tomorrow. Another interesting session. तब तक के लिए bye. जय हिंद, जय भारत.